Keep this tube clear. This will help reduce the chances of inflammation. Make sure the perineum is not red or swollen with discharge. Once or twice a day, use warm water to make sure the perineum and the opening of the urethra, that's where the patient's pee emerges from, are clean. When you do the washing, you need to pour the water from top to bottom. For female patients, you need to open up the folds of skin surrounding the vulva. If the patient's male, you need to push down the male patient's foreskin to wash the opening of the urethra. Wash it with water after the patient pees. If the patient has a catheter, you can wet a cotton swab and do some basic cleaning. After a sponge bath, you can then proceed with a catheter care. Every day you need to squeeze the catheter at least once. Do not fold it or put pressure on it. Keep the pathway clear. The urinary bag's opening has to remain closed to avoid contamination. The bag has to be lower than the bladder, and you cannot put the bag on the floor. Every day you need to change the adhesive tape and its position in order to avoid a rash occurring. If there are no dietary restrictions, the patient should drink 2,500 to 3,000 cc's of water. The amount of pee should be around 1,500 cc's. The urine bag should be more than half full. You need to empty it at least 3 times a day. Remember to take notes. If the patient has a fever, blood in his urine, or amount of pee is less than 500 cc's, you need to tell a family member or notify the medical staff immediately.